Thank,
Dr.
uh, Thank you, Sahani sir and Dr. Nishant. Good evening, good afternoon, and good morning. This is the 1570th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VIPAKSHI WASNIK. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 9:30, and we have an international session from 9:30 to 10:30, and from 10:30 to uh, 8:30 to 10:30, 8:30 to 9:30, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day. You can subscribe the videos without paying any money. That's the beauty of homeopathy, International Forum for Promoting Homeopathy. The purpose of this forum is to make aware of this homeopathy among public. This is what we are doing by promoting homeopathy. So let me come to the guest of the day, Dr. VIPAKSHI WASNIK. As you all know, he is a Ph.D. scholar doing MBA and also having MBA in hospital administration and MD homeopathy in psychiatry. Working as an associate professor, homeopathic in Materia Medica Department, Merchant Homeopathic Medical College and Hospital, Gujarat. He has a work experience of more than 6 years and doing excellent job in his duty. He's a person who really loves homeopathy and doing his best to promote homeopathy, and has presented some papers in different part of India as well as in college around. Today, Doctor will be talking about breaking free patients' journey from generalized anxiety disorder to holistic healing. As you all know, holistic healing is a very, very important aspect as far as the cure is concerned. So let us proudly welcome the guest of the day, Dr. VIPAKSHI WASNIK. Welcome, Doctor.
Thank you, Dr. Dhanesh sir, for this for my introduction. I directly come to the presentation of my case. As Dr. Dhanesh already tell that 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 the title of my presentation is Breaking Free, a patient's journey from a generalized anxiety disorder to holistic healing. So, this presentation highlights the importance of a holistic approach in addressing complex cases like this one, which I am about to share. We will explore the integration of homeopathy, lifestyle changes, and nutritional support for comprehensive care. So, here is an overview of our patient, Mr. SSP. He is 27 years old male, married for 1 year, and working in private sector. Patient's purpose of visit to my clinic was to seek homeopathic treatment for his complaints and to reduce his dependence on allopathic medications. This case offers a deep dive into the interplay of lifestyle, mental health, and physical health challenges. So, history of the presenting illness. Patient's primary complaints included chronic fatigue, anxiety, and occasional panic attacks. Despite sleeping 7 to 8 hours at night, he woke up feeling unrefreshed. He also struggled with focusing at work and suffered from headaches, later diagnosed as migraines without aura. He tried yoga and meditation along with this, but he discontinued them due to physical discomfort, including back pain and leg cramps. His symptoms worsened during period of high work stress, further affecting his overall well-being. So this is the LSMC of our office chief complaints. As you can see, patient feels persistent worry and restlessness with tightness as if a weight is uh, sitting on his sternum. Complaints aggravated in evening. Feels like energy is being drained, aggravated in morning. A deep sense of hopelessness and feeling unmotivated, aggravated in morning. Difficulty in concentration, aggravated in morning. Irritability, sometimes he snaps at his colleagues and family over minor issues. All these complaints are aggravated in morning. Sometimes few episodes of weeping, aggravated mostly in cloudy weather, with no any suicidal thoughts and ideation. All these complaints are from since 3 months. Onset is gradual, progressive, and intensity is moderate to severe. Other complaints including disturbed sleep since 3 months. Patient must wake up 2 to 3 times at night with difficulty in falling asleep with no nightmares. Complaints aggravated by constant crowding of thoughts and anxiety about his daily business. A patient feels ameliorated by zalopion. It's an allopathic drug, a sleeping pill. After taking this sleeping pill, patient feels better. Again, the onset is gradual and progressive in nature. Along with that, patient having left-sided headache since 2 months, pulsating type of pain, radiating, the pain is radiate behind the left eye and then the left shoulder blade. This headache is aggravated due to lack of sleep, aggravated by hunger, and ameliorated by naproxen, allopathic drug, and heart pressure. Along with this, patient having accompaniment complaints like nausea, dizziness, and photophobia. These complaints are also onset is sudden, progressive in nature, and intensity is moderate to severe. If you can see the frequency 1 to 2 times a week, this is for the headache and nausea, dizziness, and photophobia. This is the overall, these are the picture when complaints for patient came with me. So moving to the physical generals of the case. So physically, patient presented with central obesity, moderate perspiration, and perspiration and his preference towards sweets and sour foods. He identified as a chili patient and noted aggravated with cloudy weather and motion. His past medical history includes COVID-19 infection in year 2020 with no major complications. Family history revealed hypertension in his father and diabetes in his mother. This factor provides additional context for his constitutional tendencies. From this, we can also identify his the fundamental miasm, which is going towards the psychotic. So this history is very important for the miasmatic understanding of the patient. When we move to the life investigation, the patient was a high achiever in school, very good in academics. He had a strict upbringing, and he also had an anxiety about failure. This life space information is relevant when we define the patient as a person, which will come in later slides. The current lifestyle. Patient life space reveals that the impact of his high pressure job, where he works 50 to 60 hours a week with tight deadlines, and he rarely does exercises. He relies heavily on energy drinks like Sting, as a cold drink and coffee as a hot beverage. This is his daily routine. He has irregular eating habits, relying on fast foods and stimulants like coffee and energy drinks. His daily routine includes skipped meals, heavy dinners, and very minimal to no exercises. His hectic lifestyle combined with stress has negatively affects his mental and physical health. So, family and social life, his relationships are strained because of his mood swings and his fatigues, and this hinders his ability to engage with family and friends. So, because of this, patient having very strained relationships with his family and friends. So, after thorough evaluation of our patient, I diagnosed this patient as generalized anxiety disorder with MDD, major depressive disorder, and migraine without aura. So, patient as a person, we can see that patient is very much ambitious, industrious, irritable, and anxious. These attributes are traced in a patient's life space, which we already see. So, this is the totality of the symptoms. When we analyze patient's totality symptoms, we identified a key mental symptoms, which includes anxiety, irritability, fear of high places or fear of heights, and difficulty in concentration. All these complaints are aggravated in cloudy weather. Uh, Physically, patient presented with sensitivity to cold, craving for sweet and sour things, aggravation at cloudy weather again. Specific symptoms include sleep disturbances and pulsating type of pain in head. Uh, from this totality of symptoms, we can come to the remedy selection. But before that, I did a repertorization. So by using a Kent's repertory, the following rubrics were selected. As you can see on screen, these rubrics reflects the patient mental state, physical generals, and particular symptoms. This helping us to narrow down to the most similar homeopathic medicine. This is the repertorial totality. As you can observe, the most similar drug is Naxomica on a first place. So the remedy chosen was Naxomica in 1M potency because patients showing moderate to high susceptibility. So by considering his moderate to high susceptibility, I choose 1M potency. And also you can see the follow-up criteria, which guides me when patient comes for the further follow-ups. So this is the follow-ups of a patient. As you can see on 7th June 2021, case taking was done and the first dose of Noxamica was prescribed. On first follow-up, means on 16th of June 2021, patient reports 20% improvement in worries and restlessness, 20 to 30% improvement in concentration, while other complaints were SQ, status quo. So same medicine was prescribed, that is Naxomica 1M, 1 dose HS for 1 week. On second follow-up, patient reports all his complaints were SQ, status quo, no improvement at all. So I repeat the same prescription, Naxomica 1M single dose. On third follow-up, patient reports that all his complaints were again SQ, no improvements since last follow-up. So I thought that repetition of doses will work. So I prescribed Naxomica 3 doses. Still, patient is not improving. And he took allopathic medication for the same. So I again increased the dose and prescribing Naxomica 7 doses per week. On fourth follow-up, as you can see, even after prescribing the most similimum in higher potency, and gradually increasing the doses, patient's complaints were remain standstill and not improving at all. So I thought there must be a maintaining cause which prevents the cure. So at on the fourth follow-up, I re-evaluate the case and advise him to do a serum magnesium level and bring the reports on the next follow-up and keep the patient on SL. On fifth follow-up, around 15 days later, patient came with reports of serum magnesium level. It was 1.18 mg per deciliter. It is considered severely low as normal range is between 1.7 to 2.2 mg per deciliter in males. So this severe deficiency of magnesium is now linked up with the symptoms presented by the patient, and I advise him a magnesium glycinate, a magnesium supplement at 550 mg daily night doses for 1 week. And again, keep the patient on SL. No homeopathic medication was given. On sixth follow-up, as you can see, patient reports of approximate 50% improvement in all his complaints, and he was not taking any of sleeping pills, and he never had any episodes of migraines in last follow-up. Here, I would like to share a few important points regarding the magnesium. As I advise him taking magnesium glycinate, because magnesium glycinate is absorbed around 80% when it is in GIT, and it will not cause any side effects like diarrhea, unlike other magnesium supplements. So I prescribe him magnesium glycinate. So coming to the seventh follow-up, patient shows gradual improvement in all his complaints, and he reports approximate 80% improvement in all his complaints. So I advise him to continue his magnesium supplements for another 2 weeks. But after seventh follow-up, patient was discontinued, and he will never report again. So, learning from the case, what I learned from this particular case. This case highlights the importance of holistic understanding. Beyond homeopathy, addressing nutritional deficiencies like magnesium and correcting dietary habits plays a vital role in patients' recovery. Magnesium supplementation reduced fatigue and improved sleep quality, and all his other complaints for which patient comes to me. Magnesium plays a very crucial role in reducing anxiety and improve the sleep quality. But keep it in mind that sleep quality only improved when magnesium is given in glycinate form, because that glycinate part in magnesium helps to improve the sleep quality. Merely magnesium will not improve the sleep quality. So, as I already mentioned, nutritional deficiency acts as in maintaining causes, obstructing the curative action of homeopathic remedies. Without addressing these deficiencies, homeopathic treatment might not show, homeopathic treatment might show limited or temporary results, which you can see in my case. Here, I would like to quote aphorism number 6 of sixth edition, that is Unprejudiced Observer, where Dr. Honeyman says every homeopathic physician must be unprejudiced one. But in this case, I was become prejudiced uh, when patient comes to me and I try to treat him with homeopathic medicines only. Even after a repeated failure in repeated follow-ups, I tried and tried, but if but at that time, if I was unprejudiced as per the sixth aphorism, I take immediate action after third follow, but I failed to do so. So this is my very important understanding for me as a doctor. So I finally take away. So the final takeaway from this given case is rigid reliance on remedies may overlook the key contributing factors like stress, lifestyle, and dietary irregularities. By integrating the collaborative care and tailoring interventions, we can enhance the overall efficacy of homeopathy. That was my understanding from the given case. So, thank you very much. In conclusion, recommend, I would recommend a patient-centric approach combining homeopathy, lifestyle adjustment, and nutritional support. That was my understanding. So thank you for your attention, and I welcome questions if you have any, please.
Thank you, Dr. VIPAKSHI WASNIK. It's really a very good case indeed. And I thought that we could present some 2 or 3 cases in this session so that we have
Okay.
half an hour remaining.
Okay.
If you have any more case to share, it is better to go ahead with that also. If
No,
you want,
actually, I have this particular case only for, I actually prepared this case for this presentation only.
no problem.
There are few,
No problem. We
there are
can,
few questions are in
yes, yes, there are questions.
chat box, sir.
So we can go ahead in that way. And I
Yes, sir.
invite, before going to the question hour session, I invite Dr. Beatrice to begin the session.
Yes. So thank you very, very much for that really interesting case because the patient was suffering a lot. And I agree totally with you. It was a clear picture of Nux vomica and all these habits of with the energized drinking. So very, very impressive and excellent to give us that information about magnesium gluconate. But my question, as you are specialized on also psychiatric diseases, why did you think mainly in magnesium and not in other parameters of the like vitamins or other parameters? Yes, that's my question.
Okay, ma'am, as we can see, when we uh, study the magnesium deficiencies, so we can
Hmm.
link up. See, magnesium is a very crucial element in our body. Magnesium plays a important role in absorption of calcium also. It facilitates the entry of calcium into the bones. So if a calcium, and in my case, the patient is vegetarian. So that was the one important aspect from which I guide towards any deficiency. Other thing is lifestyle changes. If you can see that my slide, patient constantly skip his regular meals. He constantly means hopping on fast foods, and he's constantly drinking coffee. Coffee again, if you the person drinks lots of coffee, then again coffee will obstruct the absorption of various important nutrients. So I consider that initially from the given case I thought it's a magnesium deficiency, but later on I plan to do other investigation, but patient will not come after the given case. So that's my limitation in this case.
Yes, he did not come back because he was so much better. So it was really impressive and also interesting for me, Dr. Vipashi. If we think about the homeopathic magnesium salts, quasi all of them have the aggravation in the morning. The morning aggravation is very typical for magnesium muriaticum, magnesium phosphoricum, magnesium sulfuricum, and so that also could be a connection with the homeopathic way. So if we are thinking about I'm speaking from Germany at the moment, and in my clinic, I like very much magnesium salts as homeopathic remedies. So as we know, one of the main main features of magnesium salts is also a difficulty in the family, not being a happy child. So he was very ambitious with the parents, but there could be some influence. And interesting with that case, perhaps if he would come back, we also could think about a magnesium salt in homeopathic potentiation. That would be also perhaps a nice idea.
Okay.
Yes, ma'am.
Yes, that's a very, very important point that Dr. Beatrice has shown this way. It's shown into the session. Congrats, Doctor, for that. I hope. Now it is the time for Dr. Preeti to say something. She has some.
Hello.
Yeah.
Hello. Good evening.
Please introduce yourself. You are from which part and what have you?
I'm from Qatar. I'm from Qatar. I'm Dr. Preeti Desai, and I like this case, and I like the honesty of this doctor that he immediately shifted to the magnesium glycinate, where he was not able to get the result from homeopathy. But we can use biochemic also. I That is the one question. And if we see this as a whole, this patient, can we go for this cortisol hormonal disturbance? Maybe because all this his uh, appearance is also from middle belly is weight is more, and there is no BP measurement also there. So if it is a mental case, a mind related case, then we should check the cortisol hormone also. And also why he has not used biochemic magnesium or homeopathy magnesium.
Okay.
Why he choose the
First of all, okay. So initially, when it comes to the cortisol, so ma'am, there is another maintaining cause. As we can see that he's working in a very stressed work. He's actually working in IT. So that cause cannot be eliminated because he can't leave that
stress is
particular
everywhere.
job and
Stress is everywhere.
recover. But patient is not able to recover from that particular stress, man. Patient is not able to cope up
Hmm.
from that particular situation. And
Hmm.
along with that, when in psychiatry, if we can see and we can link up, when we link up the psychiatry with the deficiencies of various elements, so we can directly link various, complaints. Like in this particular case, we can see the depressive symptoms. We can see a constant crying. We can see patient is not able to sleep. So patient is in a vicious cycle. I have to break that particular vicious cycle. So that's why I prescribe him magnesium glycinate. Coming to your another question is why I can't use magnesium salts. Uh, Initially, I thought of, but seen that particular patient because I don't have any pictures or videos of that particular patient. So seeing that particular patient, I thought that magnesium salts might not work because I already failed him in around 2 to 3 follow-ups. And in the last
Hmm.
follow-up, when I review the case, patient says, "Ki I will come for the last time. After that, I will
Hmm.
discontinue because your medicine will not work on me." So that was another thing which is in my mind. So that's why I immediately prescribe him magnesium glycinate.
As he is having headache, have you measured BP?
Ma'am. Vitally patient is stable. Actually
Hmm.
I failed to mention that in my case, but vitally
Okay.
patient is stable and there is
Hmm.
nothing
Hmm. Hmm.
abnormal in blood pressure.
Why not biochemic support of magnesium? That you told that salt you tried, but have you
Huh.
tried biochemic and
No,
even
ma'am.
potassium
I
also?
don't get any.
All Kali group is also
I
covering
thought of.
anxiety.
Yes,
Mm-hmm.
but the patient's totality is not for the homeopathic medicines. I keep the patient on SL and patient will recover from the magnesium supplements only. So there is no any need to push homeopathic
No,
medicines
I
in the
like
given
that.
case.
I like your honesty and that you are using a magnesium supplement and you covered the case and really you got the result. That's so good. But homeopathy is always having some totality. We can't find that's a different thing. But homeopathy is always supportive for today. You can't say that patient homeopathic totality was not there,
Yes. Yes, actually,
Totality was there,
isn't
ma'am.
it?
Yes.
Yeah, we
Yes.
always get result with homeopathy. And one more thing that you are saying vegetarian diet. I have worked on this deficiency things that in vegetarian, the green leafy vegetables always are having magnesium. If there is no magnesium, the leaf will become yellow. Because of magnesium only, chlorophyll gets a green color. So green leafy vegetable always gives a magnesium. So you can give the diet of magnesium and with that homeopathy support.
Yes, but
So
ma'am, if
spinach and
I
all the
would like to
green leafy vegetables. Yeah, please refer all these
sure,
things.
ma'am. I
Thank
would
you.
like to
Thank you. Thank
yes,
you
yes,
for your case sharing and your honesty. Thank you.
okay.
Exactly. Frankly speaking,
Sir,
we are so.
I would, yeah. Sir, I would
Yes,
like to bring your attention to this particular slide. As you can see, his daily routines. This is the normal patient's daily routine. So as you can see, patient is not doing any type of breakfast. He have very little time during lunch also, and he is also mostly skipped. So he is
This is
consciously
normal
snacking
routine
on
for so
processed
many.
foods.
uh,
That
sorry
patient,
for this
that patient,
interfering. Sorry for
yeah,
that. But
yes,
this is
yes,
the normal routine for everyone nowadays in students and small children's going to school and all the USA people, for example, the children who are studying abroad, all are having the same routine, all are deficient in so many things, not only in magnesium.
yes. But there is other contributing factors, that his working environment. I think that is the exciting cause when we talk about homeopathy here. And the magnesium deficiency becomes the maintaining cause. So because of that
Mm,
exciting and maintaining cause, we have seen this type of disease picture in given case.
yeah. Yes.
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 And Dr. Beatrice want to say something more here.
Yes.
Yes,
I like your case very much because you were treating without homeopathy. I like that because sometimes our eyes are a bit closed. And it's a very good example that we have to be aware of these deficiencies of the supplements. Um, of course, that patients with a migraine, with a weakness, not sleeping well, would be an idea for magnesia. But I like your case very, very much. And I have a question. I'm not sure. You were talking that this person was very stressed by his work, and it was a work with IT, with computer. Is that right?
yes,
Yes.
yes.
So I'm not sure, but I think I heard that also the computers are emitting substances. If you are sitting many hours in front of a laptop, of a computer, there seem to be substances also influences our body. Some are more susceptible than others. And I think I heard that also can cause a deficiency of magnesium.
Uh,
So
that's a very interesting.
I'm not 100% sure, but we have to be aware of this.
Yes, yes.
So perhaps in the future, if you have IT patients, perhaps we have to think also about magnesium. Just
Sure,
Uh,
definitely, ma'am. That's a
uh,
very important observation, and it's a very important uh, your contribution. So I'll think about this, and I'll keep this your suggestion in my next case if I find this type of case again.
Dr. Vasnik, I would like to add some more thing because we used to say that
Yes,
homeopathy is just like mathematics. You may hear, you may be knowing that. As you know, what we have to do is take the case in detail, then minus the total symptom common to the people, then minus common those symptoms which are common to the disease. Then you get some rare picture of the patient. Then you may go with the rare picture with the repetition. Then you can find the right remedy. For example, in this case, the patient is coming from the IT category. We all know that these people need to work in night time rather than more in night time rather than in daytime. So their habit are entirely different from those going in the schools or colleges or offices. So in those category people, it is quite common that they have to spend the night, as though they may have sleepless night in the night. They may not be able to sleep in the day also. So that may be the precipitating cause for all this problem. So we will have to consider some remedies in that category that may come to that person. And not only you are giving more importance to the deficiency. Actually, it is not the deficiency that is the question here. Here there is something else. The cause behind the illness is different. So we have to find what is the cause behind the illness. That is because of the pressure and so anxiety. What will happen to me? What will happen to the company? Whether I get promotion or whether I may be depromoted, like that. These are the anxieties. So you will have to look into the patient's life, whether is there any problem with the patient himself. So you get what is the real patient in him. For example, sometimes cocculus may come into the picture, sometimes natremur may come into the picture, sometimes Staff's diagram, he may have to, sometimes lycopodium may come into the picture, and sometimes some other remedies. So this is what a homeopathic doctor need to look into. And this is how a homeopathic doctor can build his career by treating such patients. And definitely in those cases, if you can use Califos, Natremfos, and Natremur, all these biochemic for maintaining the deficiencies, the so-called deficiencies. Deficiencies are not the cause behind almost all illness. Of course, there can be. For example, we used to say, oh, this patient has having hyponatremia, so that they are giving sodium. So in those cases, we can use Natremur 3X. That will do wonderful job in that case. So each and every case is a separate one. You will have to look into each and every patient in a different way. Then you get the right remedy for a right patient, and that will definitely bring back the patient to health. Not only that, you cannot give counseling to the patient, all patient. So the medicine will give the right counseling, and the patient will be able to adjust in such a way that because he cannot resign from the job because he is interested in the job. Sometimes he may be thinking about going higher and higher way, but unfortunately, he may not be able to compete with others because they are also better personalities like him. So they are also competing with him. So there may be a competition going on. This may be the precipitating cause for the illness. So as a homeopath, we will have to find out what is the real cause behind the illness. If you are able to find out the real cause behind the illness in that way, the mental way, not the physical level. When you think about the physical level, these deficiencies come into the picture. And this is the duty of the allopathic professionals. They are treating in that way. But as a homeopath, we need not to look into that way. Of course, we know that this is the reason, but this may be the reason. You can add something, or you can mind something. That's what a homeopathy doctor can do. But treat the patient and not the disease. This is what my advice, so that you can become better homeopath in the future.
Sir, I would like to mention that particular what you say, that what is the cause of this particular, the root cause of this illness. So you see, you can see this slide. See this slide space.
No, you are not. We are not able to see.
I just want to explain this particular thing.
The slide is not coming.
See, in his.
You may have to reshare. You may have to reshare it.
Okay. I just 1 second. Right. Now it's visible, sir?
No. Not at,
No?
You have not yet shared.
Just a minute.
Yes, it's coming.
Okay. So, see, my question is, he is not alone, his company. Other people's also facing the same environment. But why this particular patient is affecting this much? So when we can trace that particular thing into his life space, in his early life, so you can see that patient come up from the middle class family, suburban neighborhood, and he is a high achiever, excellent in remedy, perfectionist since childhood, and he having a very strict upbringing. As in Indian context, you can see that a strict mother father, they have to push their children's little further to achieve high in their academics and later on in his careers. But this type of upbringing may pressurize the children, and that upbringing may affects and they become anxious. So these anxiety you can see in his patient. As a person, if you can see that patient is ambitious, working tirelessly, become industrious, irritability because of his current environment, and anxious since his childhood because of his upbringing. So these factor may also precipitates and bring out this particular picture, that we can also see this, because these things we cannot reverse, but we need to understand the precipitating factors and root cause, uh, which I identified in this given case, sir.
But in this case, for
So
example, let me interfere a few minutes. In the life
sir,
phase of
please.
a person in the childhood, you can see that there was a clear picture of this.
Magnesium,
Uh, uh,
carcinogen.
of course, magnesium carcinosin is there, running high and hard there. So,
Yeah,
so the carcinosin was the remedy to be selected in that way, because
yes,
he was having trouble from the very childhood. So he was just like
childhood.
he is competing with one another. He is doing getting result, and all he has to take pressures during that time because of the studies and everything. So in those conditions, carcinosin may come into the picture, and that carcinosin, even at the age of this say 30 or 40, will work, and that will bring him to the reverse. It will definitely reverse the person in back into the picture, this back to normal, that we can say. But unfortunately, you must. I'm not criticizing. I just giving how to go ahead in cases, in such cases, because there we miss the case. You just go went up
Yeah.
next omega. But
And
yes,
one
just
more thing, to add this diagnosis is also really who has given this diagnosis. That is also
Ma'am, I am here.
important for me, a criteria, because it's a to give major depressive disorder, and it's a kind of performance anxiety is also there, and it's kind of but I will doubt for this major depressive disorder.
yes, yes, Dr. Beatrice, you can also add here something more, so that we can go with
So I
the.
feel we have
Yeah,
a very interesting session because there's a lot of discussion going on. That's very good. And
yeah,
Dr. Danish,
yeah,
I totally agree with you, uh, your point of view that we have to look also for the source behind that disease. And I
mm,
feel you are a really 100% homeopathic doctor, and you are
yeah,
totally into your subject. I appreciate very much. Yes. And nevertheless, it is interesting that with the magnesium in material form, the patient was so much better. So our idea could be he could perhaps use a magnesium salt, also that kind of upbringing, perhaps not feeling so much love from the patients. The parents is from the parents. The parents were there. Perhaps in form of love, he was feeling more lonely. That could be. Okay. And I would like to share to the group also an experience of mine about magnesium muriaticum. For the beginning of my clinic, I did not use that remedy very often. No, not really. But there was a point I was understanding. We use natrium muriaticum a lot. Everybody of us. Natrium muriaticum is like every day we give it to our patients. We have a clear picture and it is working well. So I discovered for myself magnesium muriaticum in a certain form can have more or less the same picture like natrium muriaticum, but the personality is more soft. It's more defensive, more soft, and more sweet a bit. The symptoms can be more or less the same, but of course, the morning aggravation is very strong in magnesium. And if they have some muscular cramps, okay, also away from magnesium. And there's a keynote of magnesium muriaticum. That means if they have heart problems, they prefer to lie on the left side, which is strange. They like to lie on the left side. And this symptom sometimes helped me to catch magnesium muriaticum. So at the moment, for me, I nearly use as often as natrium muriaticum in my clinic.
Yes, that's good. That's good. Yes, now it is up to Dr. Wasnik to say your comments on all these observations.
See, I would like to say there is a thing called individualization in a case. Uh, we can see the same patient from the different perspectives and from the different angles. And Dr. Hanneman summarized this thing in individualization. So every individual, and this individualization is based on the doctor also. That's I feel if my perspective my perspective may be different from Dr. Dhanesh and any other. So if when your perspective is different, your angle to see the patient is also different. And when it become different, the totality also changes and the remedy selection is also changes. So whatever the discussion is going on right here, everything is acceptable because everyone is seeing the patient from the different angles and the different perspectives. So that's that thing I say. That's the beauty of homeopathy, as you can say, that we don't have any clear-cut guidelines to see and treat the patient. Everyone treat the patient as per their understanding and as per the individualization. That was I would like to say.
The
There is
objective here is to we have to take all the approaches, and the standardization is important. That the
Yes.
most useful standardized things which we can do means we can take all the approaches, and the best approach we can use.
Yes, frankly speaking, this is a wrong thing. Frankly, we all are working on a same principle because there are certain foundation. We used to say that homeopathy is a scientific system as well as it has an artistic part. So the science of homeopathy is a never-changing one. Exactly, there are the laws behind all these things are same. But what we have to do is that we have to take the law in consideration, and whether you follow Shankar school, Shankaran school, or some other school of thought, Saigar school of thought, but everything ends up with the patient, not in disease. But in those cases, after taking the case, then all of us need to do the same work, taking the case in detail and then find out the symptoms which are uh, common, which are specific to the patient, and then choose the right remedy. There is nothing wrong in that. Of course, you can then where you have to give the intensity. Of course, the cause behind the illness is the most important point. So that you will have to give more extra important to that area. But at times when you have no such thing, then you have to concentrate on the particular individual part. Sometimes he may be having a headache only at the particular time of disease or particular time of a day or something like that. In those cases, we can think in that lane. But the thing more as homeopaths, we are all working on the same principle, but the artistic part is different. That is the problem. The application of Dr. Dhanesh may be different from Dr. Beatrice, Dr. Hariharan, or Dr. Busby, because we are all of us are. If I am a sanguine person, I may be very quick in action. If I am a phlegmatic person, I may be a little bit lazy in that aspect. The temperament of the doctor may be also affect the selection of the remedy in a different way. There are certain people who are very strict in their way. There, as you say, sanguine people are choleric people. They are very particular. You have to take food in 7 p.m. You have to take lunch in exactly 1 p.m. You have to take the breakfast in 7 a.m. itself. So there are doctors who are doing that like that. But it all depends upon the individuality of the doctor and the temperament of the drug. But the selection of the medicine will not be changed. It will be always same or need to be same, because when we do the scientific repertorization, medicine may not be changed because the medicine may change when only when we are taking a raw case. So this is what I would like to add. But I invite Dr. Harihan sir. He is a very senior, one of the senior most doctor here in this forum. So I invite sir.
Sir, good evening to all. Okay, Dr. Beatrice, very nice to see you today. Good evening. Okay. Good evening. See, I have not heard complete the case, but I have seen only a PPT in certain PQRS symptoms of that patient. See, PQRS symptoms, I have said that now it is withdrawn. So even then in my memory, it is that patient is industrious. Of course, he is anxious, sure, and he is having so much ambitious. Okay. See, another thing is that whether the patient is irascibility, that the anger, that I don't know that the patient is having anger or not. That irritability is there, and I think he is having the anger also. So, in my opinion, that is Naxomica.
Yes, the medicine was Naxomica, sir. But the thing is that even after selecting Naxomica, doctor didn't get the result in the right time, and because of that, doctor has to give some other byproduct like magnesium salt, magnesium products. I must say byproduct.
Then see, if the case is clear, the PQRS symptom is clear, then why we are choosing another remedy?
That's why then he came back to Naxomica later and he got the result. But unfortunately,
there is no word of unfortunately. Unfortunate. See, so I just ended the web meeting. I have not seen the Naxomica also, but by seeing the PQRS symptoms, it is sure that is Naxomica. There is no other thinking. You give Naxomica, then the patient will be cured. No doubt in that.
yes,
See, homeopathy is very, very, in all aspects, very, very clear. There is national highway. Why we are going to other ways? If we are seeing the case clear and the PQR symptom is correct, that the constitution is correct, then another thing we have, I like to say, the thermal reaction also is very important regarding these patients.
Okay,
Right.
doctor.
Sir, I would like to answer your question, Hariharan sir. Even after selecting Naxomica, patient is not getting any results.
Why?
So,
Why? That question
in
is why?
retrospectively,
Yeah.
why? That's why I'm explaining you, sir.
Why?
Then, I'll telling you that. So when I retrospectively analyze the case once again, actually review the case again, So I don't see anything missing. I again come to the Nux Omega. So since last four follow-ups to be precise, on since last 1.5 month, patient is not improving. So I thought there might be some maintaining cause which may restrict the effect of
Correct.
homeopathic medication or
Correct.
well-selected
Correct.
remedy.
Correct.
So to identify that and to understand the deficiencies, because currently then I analyze the life space and the daily routine of the patient. There I seen that there might be some deficiency because he has in very irregular dietary habits and his lifestyle is very bad. So I consider that also in my review, and when I try to correlate his presenting complaints with any kind of deficiencies, the magnesium deficiency is very closed in theory. So that's why I advise him to do a serum magnesium level and come up in next follow. So when patient came with the magnesium, what we can say, serum magnesium level, it is observed that a patient is very severely deficient in magnesium. So I
Yes.
stop all his medication. I stop in Naxomeca and put the patient on the magnesium glycinate supplementation. And after supplementation, patient improves. So
Correct.
that is overall of my case. That
Very good.
even after giving well-selected remedy, patient is not improving. So I try to just remove that the maintaining cause to facilitate the cure.
Very correct.
That
See,
was
that
the
is
whole
the
case.
this is the true approach. True approach. So you find out the maintaining cost and you supplied that and removed that maintaining cost and supplying some salt and the patient get cured. It is the correct way of homeopathic approach.
Exactly. This is there was an obstacle, and that obstacle was also cured. Then your Naxomica started working, and as a result, the patient was improved.
Okay.
Yes,
Very
maybe
correct.
if a patient will continue, then I'll see the effect of Nux Omega and other aspects as well. But patient is not coming to the clinic, so I
Yes, sir.
restrict there.
Yes, these are some of the things that we used to face each and every homeopath. The patient, once he
Yes.
gets the relief, then the patient may run away and he may come up some 10 or 20 years after that. Oh, doctor, I was cured by that way. And then I didn't bother about any of these things. And that's what we used to find. We used to adjust in such condition in that way. Yes, Dr. Beatrice, you want to say something more, and then you can say the vote of thanks to the session also after your comments, Dr. Beatrice.
Okay, so thank you very much. And Dr. Wasnik, you see, we are at your side. Also with Nux Vomica, everybody says it's a clear case, it's a clear case. And I feel you did it very well because you were repeating. And then you were repeating with more doses. You are really showed with 4 follow-ups, it was not working with Nux Vomica. This was strange. So I feel we could learn a lot from that case today. Thank you so much. We also could learn that from Dr. Pretty that it is important to eat green vegetables because they contain a lot of magnesium. This is also very important. And I'm very, very happy to thank you to give your presentation here with IFPH. And I also would like, for me, it was really a great presentation, Dr. Wasnik. Thank you very, very much. Also in the name of IFPH. And thank you very much, Dr. Danesh, and all the participants for your care and the ongoing, Dr. Ram also, hello, for the ongoing presentations every day. It's a great, great work. Thank you so much.
Thank you.
Thank you.
Thank you, Dr. Beatrice. Dr. VIPAKSHI WASNIK, do you want to say anything more?
I was just want to say there is a very fruitful discussion is going here, and it's my privilege to come to you and on your platform and share my case. So thank you, Dr. Dhanesh sir, and all the IFPH team. So thank you very much. Thank you.
Thank you, Dr. VIPAKSHI Wasnik, and those who attended the session, particularly Dr. Beatrice, Dr. Preeti Desai, Dr. Hariharan. So all these people are really participate in a healthy discussion. And thank you all other participants from different parts of the world to the session. Tomorrow we will have a session from Dr. Lubna Kamal, and she will be talking about biomedical waste management in Ayush. So that is also a very important subject. Hope all of you will be joining. You can also use the same link for the same meeting also. Thank you all. Good night. It's over to Dr. Mariamma John to moderate the Malayalam session.
നന്ദി ധനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം. IFPH 1570